You're listening to the 88% Perfect podcast, a place where you can come to learn and remember that we can live in the healthiest mind and body from our intuition without all the pressure to be perfect. I am Kit Yoon, a licensed acupuncturist, a life and health coach. My guests and I are grateful to be here on this journey with you today. Are you ready? Let's go to the show. Hey everybody, welcome back to the podcast. Welcome to bonus number 4 during the pandemic. And I have a very special guest today I will introduce in a second. But just to remind you, I have 3 other bonuses that I put on about a few months back, earlier in the pandemic, in March and in April. The first bonus was with my husband, Jim McDonald. Jim is a doctor and a sports medicine specialist. And so we talked about the importance of being active, importance of kids still moving and doing things, but how to do it safely. The second one was with a dietitian, Jess DiNapoli, and Jess really helps us think and do the right things as far as nourishing the body and how to stay healthy physically in that way. The third bonus was with my friend Randy Anselmo, also a family physician. And Randy wrote a really important letter out, and he shared his own perspective and how he thinks that we can really keep the curve down. And at that point, things were not looking great. So we talk about that. Today, now that we are months into the pandemic, we can see a little bit of a big picture now. And, every time I talk to my parents in Thailand, I get an update on what's happening and how well the country is doing. And really, they have done such a good job at keeping people safe and not adding to the numbers. And statistically, Thailand is one of the probably countries that's doing the best. Numbers wise, my guest is such an expert and he gave us those numbers, but basically, totally, we haven't had more than 4,000 cases and less than 60 deaths since January, since the very first case of COVID-19. So my father introduced me to my guest today, Kun Pisan Manawapat, who used to be the Thai ambassador to Washington, D.C. He used to live in D.C. and represented our country. He is retired from that position now, and he's a senator in the Thai parliament focusing on public health. So he is the perfect person for us to talk to and learn more about the magic, the secrets behind Thailand's success during the pandemic. And I am so honored and so glad that he had time and spent time talking to me and sharing those numbers and his own perspective on why it is that as a country and as a culture, we have done a good job, at least so far. So I hope you enjoy. I hope you take as much out of it as you can. And I hope you're staying safe, taking care of yourself and your family. And I will see you back here next week for a regular episode on Monday. And until then, please enjoy my conversation with Kun Pisan Manawapat. I usually bring people in. So I'm going to pretend like I really know Thai. Okay. สวัสดีค่ะคุณพิสาร
สวัสดีครับคุณคิด
สวัสดีค่ะ We will do this in English so people can understand. Tell me, Kun Pisan, why it's a very general, broad question, but so Thailand has been doing well since the beginning. Even though we're not quite neighboring to China, but we're very close to China. And I know the virus started at the end of last year. And we were actually in Thailand visiting and reading the newspaper and whatnot. We would come across this thing called coronavirus. Didn't really think much of it. And when we got back here, it really kind of became more of a thing, more of a danger, probably early March. But by that time, Thailand probably had already been experiencing some cases. But it never really exploded, really. I don't even know. So give us some data as far as how many people actually have died and what are the cases and what is it like right now?
Well, the latest as of today,
Mm.
we have a center at the government house,
Mm.
and this center meets every morning and reports to the public later in the morning. The official name is the Center for COVID-19 Situation Administration, CCSA, and we have a charming, charismatic medical doctor who acts as a spokesperson. He's good looking. He speaks very softly and well. So a lot of people follow him, miss him when he's not around and follow him every morning. And as of this morning, there are 5 new cases of COVID-19 from overseas returnees.
Uh-huh.
That means that we have not had any local transmission cases for more than 100 days, except one. And these 5 new cases come from the Philippines, Iran, India, and 2 from Brazil. The total number of cases in Thailand stands at 3,569, of which 3,379 have recovered. So only 131 remain treated in the hospital, and the accumulated death toll is 59. So 59 since January this year.
That's amazing. Wow. Okay, so currently, right now, and we're recording on the 1st of October, in the whole of the country, which we're at 80
We are
million?
65 million population.
65. Okay. I'm thinking.
And we have 59 deaths and
That's-
5 new cases. And 5 new cases coming from overseas. That means that we have to continue to be strict and rigorous on screening, detaining. Everyone coming back, including you and my own daughter, had to be put in self-quarantine, strict self-quarantine for 14 days. You're not allowed to see your parents. You're not allowed to receive anything. You're not allowed to interact with anyone. Even cleaners are not allowed to walk in and clean your room. Food will have to wrap properly, deliver at your doorstep. You open the door, take the food, and eat it, and return the empty tray outside. So you don't see anyone for 14 days. My daughter gone through that for 14 days. We know how strict it is.
Now, so does that look like, so if I flew and landed in Bangkok, what does that look like from the plane to the hotel?
From the plane, the local authority, the team, receiving team, will have your name, your background, and everything ready. They will interview you nicely, check your temperature, and they already know that by that time, you already chose the accommodation of your choice. There are 2 types of accommodations. If you don't want to pay for your accommodation for 14 days, the government will pay for you. Then you'll be put at the state quarantine center. And that means that there are designated hotels that have been approved by the Ministry of Public Health. For my own daughter, she a little bit of, she's well off. She works as a lawyer, so she can afford it. So she chose a rather luxurious 5-star hotel. And then she paid out of her own pocket of, it's around 50,000 baht, which is around 1,000 US dollar for 14 stay with full boarding and food. Not bad.
Not bad. But it still looks the same. It doesn't matter if it's 5 stars or 2-star hotel. You still are stuck in your room with the food delivered by the door.
And the hotels that had to be approved, you have to have certain requirement met. Like you must not have a carpet in the room. It has to be a wooden room because carpet can observe and keep the virus. And you must have a split type air condition. You cannot have a central air condition because that means virus can go from one room to another. So they're pretty strict about it. Only certain hotels, certain part of their buildings that can meet the requirement.
So the 5 cases that are new, they're from people from abroad. So they are automatically quarantined and will not.
Everyone has to be quarantined.
Yeah.
But
right.
during their stay quarantine, we have medical teams go and check and test them twice or 3 times. So these 5 returnees have been detected while they are being quarantined in the state quarantine centers.
Yeah. Okay. So despite people coming in and Thailand having our 60 million people, what do you think has been some of the reasons why we've done so well as a country?
Well, first of all, let me take you back to where we have detected the first case, because it's important to note that we are the first country to have detected the first case of COVID-19 outside China. We are the first country. And the date was 13th of January 2020. That already activated Thailand's emergency operation program. Just discovering one case, we activated nationwide emergency program, launching the whole society, responding across government, private sector, and civil society. So from day one, we activated our program. And this program is backed by scientific evidence, guided by collective leadership. The Prime Minister doesn't decide himself. He doesn't know the subject well, he knows that. Sure. So he called in all the leading experts and called for scientific medical advice. And this not only backed him with the advice, but they guide the Prime Minister in setting up this administrative center and the guide the Prime Minister in following WHO guideline. WHO guideline laid down very clearly that you have to mobilize society so as you can prevent, detect, trace, isolate, and treat cases as emphasized by the WHO guideline. So we follow the WHO guideline very strictly.
And it was already in place, the WHO guidelines, by January 13th.
It's already in place because we have strong infrastructure of this health system.
Yeah.
That WHO had recognized that. For 40 years, we have been doing that. We have making investment in public health infrastructure, which has resulted in expert field epidemiologists and strong laboratory capacity. And besides, we have learned from our own experience. In 2003, we have SARS outbreak from China, and then followed by the H5N1 virus. So we have been better prepared from our own experience some 17 years ago. And that experience has been valuable, that we managed to activate this emergency program because we have done that before with the SARS outbreak and the H5N1.
So what did it look like in public? So the country, the leaders decide or agreed, okay, we have to put this in place. Out in public, was it from day one that people wore masks and did the social distance?
It's automatic from day one. It's automatic from day one. And the reason why we find it easy to wear masks is that even before the pandemic outbreak, we had this the particle of PM2.5 that polluted the skies in Thailand in several major cities because of the forest fire, because of the pollution from motor vehicles and everything. And when you are not well, you tend to wear a health mask. So that is probably part of our
normal living,
practice. And the social distancing, it occurs to us that it makes sense because if you wear mask is not 100% proof. So you don't want to be too close to someone who can easily transmit unintentionally those virus to you. The example that show people the danger of not having a social distancing is that when we had one incident of super spreader in the boxing stadium. Remember one incident in boxing stadium that has resulted in spreading this pandemic to a dozen or more amongst spectacles because people were sitting and standing next to each other, shouting and cheering and all that.
There's so one sweat everywhere.
Exactly. So I think they saw the example. So with everywhere you see that there is a temperature check. You enter to convenience store, there is a temperature check. You enter into a restaurant, you enter into any public places.
Yeah.
It's a normal routine for the security officer, for staff to check your temperature. And after that, we also have this the QR code that you register your QR code at the place before you enter. So the authority has the record phone number of everyone who enter and spend their time between certain period. So if they detect any suspicious case, they can alert the rest of the people. They have the mobile phone number. They can alert them. They can ask them to come and have them check. And this way we can isolate, we can trace, we can make a prevention. There is no public debate whether we should wear masks, we should.
Right.
It's taken for granted. And then we're surprised that up until now, looking at the United States, the leading country in the world, you continue to have that emotional public debate whether you should follow individual liberty and freedom or you should follow scientific advice.
Oh my gosh. I know. I'm trying to not make this a political conversation, but
people around the world were amazed. I mean, you're better informed people. You're more educated than the rest of the world.
Yeah, medical system. Well, this is where I think hopefully we're learning about the strengths and weaknesses of different systems and cultural norms, right? So I am a naturalized American, but I never feel like anything, actually. I go home to Thailand, I don't really feel Thai because my Thai is funny. And then in the US...
No, your Thai is excellent.
Oh, thank you. But here I have moments of, I don't know what that word means. And I don't feel culturally American because I didn't grow up here. Anyway, I do think that there's a big part of Thailand's success that is cultural, that is part of who we are as a nation, but also historically. And I don't know, it's arguable, right? That because we have been a monarchy country for centuries, so that natural behavior of listening or being compliant to authority is natural for us, right? So we respect the authority.
Yeah, in a way, Thailand have always been known as undisciplined, unorganized society. we love fun. Unlike some of our neighboring countries, we tend to not do what the authority tell us to do. But in this particular case, it showed the other side of Thailand, that people can be strictly disciplined because they know it's important to follow. They have trust in the healthcare system. They have trust in the healthcare authority. They have trust in doctors. In Thailand, you see doctors, you don't want to sue them. You want to express your gratitude.
Yes.
Because no matter what mistake they make, you continue to feel that they have tried their best. So, and I think this is another difference in the terms of culture that you mentioned is that first, we don't give each other a hug when we see each other. We don't even shake hands. Right. We don't touch each other.
Yeah.
And we take a shower at least twice a day. Some people take it several times a day. So when authorities say that you must clean your hand as often as possible, it doesn't come as something awkward for Thais to do because without the pandemic outbreak, when they return home, they clean their hands.
Yeah.
They keep themselves clean.
Yeah.
And this doesn't apply to rich people. It goes for all people in society. It's the natural habit that you want to be clean. You don't want to be smelly. And I think that make it easier for the society as a whole to stand together and to combat this spread of pandemic. The most important factor that I think other countries should learn from us, we would not bragging about it, but we have been practicing it. We have established village health volunteers all over the country. There are more than 1 million village health volunteers. And I have seen some of them when I went on a visit to Chiang Mai with the Committee on Public Health in the Senate. These generally are more women than men. And they tend to be, if they're women, then tend to be more responsible in their work, more conscientious. And they know each other and they know everyone in the village, in the community. So with the training from the disease control unit, they work under the system of the Department of Disease Control. They receive training every day. They manage to transmit that knowledge to the fellow villagers. What to do, social distances, wearing your mask. If you can't afford the disposable, you can make your own
homemade
recycle mask or make masks. If there is a stranger coming into the village, they report to the health volunteer system, and the volunteer will report to the authority that we have strangers coming across the border, say from our immediate neighbors. Then we will be able to check them, test them, and then isolate them if they are suspicious. We not only train our own health volunteers, we also train 7,000 health volunteers from Myanmar so they can look after the migrant workers in Thailand who come from their own country. And at the moment, we cross the border into Myanmar to offer our technical training, to offer the PPE and certain basic requirements to their hospitals. So we are doing our best not only within the country, we are reaching out to our immediate neighbors because we have the capacity. We were short of those supply in the early part of the COVID-19 handling. But since then, we have plenty. We have built even factories producing the disposable masks, and we managed to ship them overseas to our immediate neighbors.
It's amazing. Just so our listeners know, some people don't really realize how big our country is. Thailand's about the size of California, correct?
No, Texas.
So, yeah.
So the size of France and Texas.
Okay, so not small, not huge, not small. but big enough. And the fact that we have different filter systems, right? The big one of people coming into the country, but then it sounds like, and there's the government taking action and people being compliant, but then these small units, what is it called in Thai? Osamo
is the village. Osamo, Asa Samat.
Okay. And that was new for COVID, or was that already in place before?
No, it has been in place for years, for decades.
Oh, okay.
For decades. And it had proven to be most effective.
Yeah.
People begin to realize how useful and important they are out of the COVID crisis. But they have been there all along because they have been doing a lot of non-communication disease. They have been doing a lot of healthcare advice to villagers because we want to reduce the crowdedness of government hospital in the city, in the district. So the only way is to arrest this trend coming from the village and the sub-district. So with good advice, and at the moment, we have telemedicine. So they don't have to come all the way to the provincial hospitals. The healthcare volunteer can transmit their symptoms, check with doctors working in 60 kilometers away from their village and district, and prescribe the medicine. And they can get the medicine from the nearest convenience store. They don't have to travel 60 kilometers to government hospital to get medicine. So, this kind of modern facility and logistic has become more and more available and make it a lot easier.
Yeah, and we're not talking about very modern villages yet either. But
no.
Right, Thailand is still relatively behind in a lot of ways, but putting some of these technology in place has been working.
And telemedicine costs very little. As we speak now.
Right.
They can also speak to the patient. They can check even, the skin and the nose and everything.
That's amazing. So this is not just in Thailand, but a lot of the Asian cultures, we really think of each other as relatives, right? It almost, especially when you're sort of outside the country, and I'm generalizing, but even the way we call each other, it's P Nong. Kun pu, kun ta, kun a. There's a lot of familial where we feel connected regardless of whether we're related as a country, as a culture. When we're in this sort of turbulent time, do you think that part of our culture is even more important in the way we're taking care of each other? Do you know what I mean?
I think it's very important because we see each other as relatives. Mm-hmm. That's true. Because, there is an inherent social safety net within our own society. Mm-hmm. If you're unemployed, but you register in your social security system, mm-hmm. you get temporary payment from the government. Mm-hmm. That helps out when you're unemployed and out of work. But for many people who are not entitled to get any payback from the social security system, they can live with their relatives. They can go back and live with their parents. And within the community, the village, they have food, they will be fed, they would be comfortable. And in the middle of the COVID-19, we have seen all these hospitalities, all these collective share value display everywhere. Yeah. It means that outside the Senate building, we have a shelter where senators and staff donate food, water, essential supplies, masks, and leave it in the cabinet. Mm-hmm. And people who walk by, for anyone who taxi drivers, and they can come and pick, and we request that they only pick what they need so that they can leave the rest for other people. Some restaurant and street vendors, they said it with a sign that if you can't afford it, take it free. So food is freely distributed. But I see it in America too. I see it in California. I see news from many parts of the cities where there are volunteers distributing free food to people who need it. I think it's natural, and we do it in a very natural way here.
Yeah, I think it's probably more innate, more inherent for Thai people to take care of each other. And taking care of each other also means wearing a mask and social distancing and, making sure that you're doing all the right things without questioning. Because I think in the Western cultures, there's almost like a natural mistrust of other people already. So whether that means, I don't trust what you want me to do, so I'm not going to do that. Or maybe it's not just trusting, but it's a little bit, in Thai we say "ตัวใครตัวมัน," right? Like there's this huge sense of individuality and independence, and freedom. You get to do whatever you want to do. It's your right. It's in the Constitution, and I think that kind of can be a slap in the face when it comes to trying to do something as a community, as a country.
Yes. And as a result, the Prime Minister and the government have been praised by the public as handling it well. The only criticism that comes from the public, the opposition, is how to handle the economic impact side of the pandemic. That one, I feel sympathetic to the government because you need to have a lot of money. Yeah. And so far, the government had program of borrowing money to give cash to the unemployed, to support the SME, to support the startup and all that. But a lot of people live on tourism industry. They are dependent on tourism industry. When you have a normal 35 to 40 million tourists expected to arrive every year, suddenly it comes to nothing.
Right.
That really is a disastrous to so many communities that rely on tourism and export also. So this is a hard time, not only for Thailand, for many, many countries. That is a big, big challenge ahead for this government to overcome the economic difficulties. We hope very much that with the vaccines coming in and international travel resume near to normal again by the end of next year, then things will become a lot easier.
Well, you'll be our first destination for our countries. We'll be excited to come back.
We are custom made. We are designing a mini program for long-term visitors. We are allowing them to come if they stay long-term. That means they have to register in a self-quarantine center for 2 weeks. And after that, they are free to travel in certain designated islands. So if they prefer Phuket or Samui, that will be the sort of destination plan by the government for long-term stay.
Well, we need to also tell people that during their self-quarantine, they get to eat Thai food. So that might be...
Exactly.
That might just be one impetus.
Incentive.
So, and I don't want to get into this at all. Like I said, I don't want to bring politics into this. I do want people, the listeners, to know that we are not great in our political climate right now in Thailand. I mean, we have our own issues, big ones, lots of protests and unease. So it doesn't mean that we're doing great in every way. It just happens that with the pandemic, everybody agreed that this is the right way to do it, and everybody complied, and that's why we're doing great. But if you look at politics in general, oh my gosh, Thailand is, I don't want to say bad words, but it is. It is.
No, I think I welcome the coverage of the international media.
Mm-hmm.
I think the fact that protesters have been allowed to protest shows a high degree of our development towards full democracy. And if you watch the news, protesters, they wear masks. They all wear masks. And the Ministry of Public Health set up an entrance to temperature check everyone going to inside, and they do their best to observe social distancing. So I think this probably is one of the few countries where protesters, almost 100% of protesters and police officers wear masks.
They're still following the rules.
and I listen to speeches and comments and protest slogans by these young people. I feel happy about the future of Thailand. Because they could have spent that time walking in shopping mall, seeing cinemas, enjoying their, leisure time as, previous generation do. But they take a risk. They have the courage. They have the courage because they can be arrested. They can be put in jail. They can appear before court. They have been warned that, they have the record. So when they seek employment, employment look at their record, might not want to hire them because they're activists, they're troublemakers. So I commend their courage. I think they have more courage during my time when I was a student. And I think if they are going towards the right direction of demanding accountability, transparency, full democracy, return power to the people, constitution drafted by the people, representative by the people. I think they are walking on the right path. I don't like it when they go towards making harsh criticism on the certain institution. I think they will alienate their supporters.
Yeah. Well, best of luck over there, and we need the same thing over here as well. Before I let you go,
I keep reminding people I talk to that although we are deeply divided, in my own judgment, we are less divided than United States now. Situation in United States.
Yeah. And, in some ways, maybe the pandemic sort of brought people together as well, because we all we should have the same hope and goal of, just staying a healthy country. Before I let you go, because I want to respect your time as well, just for fun, I know you've spent time in the U.S. here and there, but is there anything that you miss about living in the U.S. that you don't get to do in Thailand?
Washington. I miss Washington. City, I miss the politics. I meet the people I know. I miss the politician.
You do? Oh, goodness. You can come back anytime. So you miss Washington, D.C., you miss politics. Anything else about the American culture that you miss? You probably don't miss the food here.
Well, I'm fond of everything, actually. I think it's I like the way people can be direct to each other. And you don't have to be offended by being directed to each other. Yeah. I like that kind of attitude. Here in Thailand, you don't want to be too direct to somebody you don't know well. It will be the end of your...
Oh, believe me, my parents remind me every time I come back. They're like, you can't do that. It's like, what did I do? I have no idea.
So I said to my fellow diplomats that sometimes you have to be less Thai and more American, especially when you deal with American counterparts. If you are Thai and gentle and subtle, you'll be exploited. Right. If you're tough, straightforward, you'll be respected. Yeah. No, it's true.
But when you're in Rome, do as the Romans do, right?
Exactly. But we have our own charm. We have our own characteristics.
Absolutely.
That even though we are direct more than an average Thai, we can be skillful enough to charm them.
Yeah, for sure. We can create our own specific ways. Before I really let you go, any wise words for us here to do our best to get rid of COVID in the US, or not get rid of, but manage it?
No, I think America has this exceptional ability to overcome difficulties. And I trust that ability, I trust that potential. People have that. I think if there are wise leadership can guide them, not necessarily from the White House, at the state level, governor, mayors, community leaders. I see this beautiful characteristics of American people, that they are wise, they are practical, and they will do the right thing.
Yeah, they just have to do it though, right?
Exactly.
I think that's the part that's missing in some places. It sounds good. Intellectually, they understand it, but they might not actually be doing it. Yeah. Well, thank you so much for your time. And hopefully I'll get to see you maybe within the next year if we're safe enough to. All right. Thank you.
Good luck. Stay safe.
ค่ะสวัสดีค่ะ Thank you so much for listening to this episode of the 88% Perfect podcast. If you enjoyed it, I would love for you to subscribe, rate, and review on iTunes so that more people can practice and start living this more than good enough life so that they feel healthy, they feel better without all the pressure to be perfect. For show notes, free resources, and simple recipes, you can go to my website, kityoon.com. You can also make an appointment to speak with me for free over there. I am offering some few free coaching sessions a week, and that's when I can show you how you can feel better now. It is simpler than you think and definitely does not require perfection. So until then, I will see you back here next week for another episode.